Hey, this is Emily Mike. I'm with Building Futures Pediatric Therapy, and I'm going to talk a little bit about picky eating today. When you have a child that's a picky eater, it could be for several different reasons. It could be a physical thing, but a lot of times it's a sensory thing. And sensory problems, occupational therapy can treat. So if you have a child that won't eat things that are slimy, or maybe they won't eat things that are crunchy, or maybe they won't eat things that are spicy, or maybe they love things that are spicy and won't eat things that are bland. So that might be a sensory issue. I know I had a patient at one point where she wanted to eat things like grapes and spaghetti, things that maybe have a little bit of a colder or slimier texture. But anytime she saw them, you would see like her pupils dilate and get real big, and she might even get teary-eyed. Sometimes she would try to eat it, put it in her mouth, but you would notice her skin get red, and she would start to sweat. So those may be some signs that you can look for in your child if they're having a sensory issue to the foods that they are trying to eat. Now, the problem is if you try to force them to eat those foods, then you can get a lot of other problems, behavior problems. You can increase their anxiety, which really affects their whole body. So when you come into occupational therapy services, we treat the nervous system, because that is the system that controls all of these sensory things. And we help that nervous system to really calm down, and so that the child can tolerate those foods that they're wanting to eat, but their body is just rejecting. So if this sounds like a problem that you're dealing with at home, then bring your child in to Building Futures, and we will do a full evaluation, see if we can identify the problem, and help you and your child to come up with a good treatment plan and get them to where they're eating a more healthy diet.